That's hello.
We need to take your photos. So I'm going to take you to a room just down the hall. Your case is going to be great. So you've watched all the videos, huh?
I feel like I've watched every video twice.
That's good. Yeah. So I was reading what you wrote in when you were inquiring about this.
Yeah.
And you've had pretty big weight fluctuations, right?
Yeah. I was overweight my whole life as a kid.
Yeah.
I did get into like decent shape in high school for a little while, and then my weight actually spiked up to 267.
Wow.
So
seeing you today, that's hard to believe.
Yeah.
Did you know him at that weight?
No, I didn't.
Yeah.
She found me at a good time. So.
Kept you, I see. Well, cool. Well, you did write about things that I see all the time, like the swimming. You don't want to take your shirt off, you know, that insecurity that you feel in your clothes and all of that. And that's kind of a standard thing that I hear from everybody, is all of that. Well, let's take a look at you here.
Yeah.
Okay, you can lay back on this. So you're in great shape. Good job.
Thank you.
Congratulations.
Thanks.
The one thing that we're always looking about is the skin integrity here. And you can tell that he's had fluctuations in his weight because the skin is obviously looser than you would assume it would be, right, for a guy with his build. The cool thing is that you're young and that your skin will go back. That's the impressive thing. And a lot of doctors would possibly say that you need to excise that skin. Dr. Caridi obviously does not recommend that for you because he knows what the skin can do. It's really impressive. After all these cases that we've done, you learn about skin and you learn, like, when I look at you, I can tell what it's gonna look like, you know what I mean? Now, that being said, we do have to work on keeping the skin flat against your chest as it's healing, and we've been stressing this for a long time to you guys. And that's the reason we use that lipofoam. I wonder if I have any. Nope, I don't have it in here. But I always describe it as like a piece of a memory foam mattress that you put up against the skin, and it literally secures the skin down, and it heals that way, and that's what you want. So your job will be to make sure that that skin is flat all the time. And it's so good that he's open with you about this for so many reasons. But one is that you can be like, hey babe, check your skin. Like, did you check it out? You know, maybe help him in these first few days when it's hard to do, and you can just help him on the journey. So he is a little bit asymmetrical. This side is probably a little bit bigger, I would say, but definitely nothing that can't be fixed with this procedure and what Dr. Caridi is going to do for you today. You will have an incision up here and up here in the axilla, and then that small incision around the base of the areola right here. He'll look great. And so are y'all going to Fort Worth today?
No, we're here until Wednesday morning.
Okay, good. Well, maybe we'll see you back and we'll show the follow-up, and then I can show you about skin and all that good stuff.
Okay.
Is there anything when you're watching these videos that you think that we should point out or add or anything?
For me, and I told you, I feel like I watched every video you guys have put out. I was always looking for cases that were similar to mine.
Yeah.
And like just watching the videos and seeing these guys get these great results gave me so much confidence. And that's why I opted to do a video, for someone who's watching and who's suffered the same thing that I have.
Yeah.
I hope that I can, give
you can help them.
Yeah.
Everybody says that. They want to see a case that's similar to theirs, and it makes total sense, right? But that's why I'm always looking for people to volunteer. So if you're scheduled for surgery with us and you want to do a video, let me know. Because it's not that easy to find people to do it. I mean, we're pretty lucky. We have a ton of videos, but it does help people so much, And
I understand too, for guys with gynecomastia, they know, it's a embarrassing thing. It's a difficult thing, and also to share, to others, it's not easy to do.
Well, Dr. Caridi preaches about the brotherhood, and I believe in it. He's always telling people, help others, help others, help others. Yeah. So like write about it, like, give a review, tell about your experience here, whatever that may be for you, and so we appreciate it a lot.
Of course.
All right, so we'll probably have Dr. Caridi come in and show him marking his chest with the Sharpie and talking to him a little bit, and then we'll get back to the OR and get this taken care of for him. Cool thing is, this is going to be completely handled in an hour and a half. There is a huge healing process that takes place after this, though. So in a lot of ways, it'll be instant gratification for him, because when you guys see him at the follow-up, hopefully tomorrow or the next day before y'all leave, it's going to look so much better. but it's a whole process of months and months and months. You know, I have guys call that are about, 3-4 weeks out from surgery. I had a guy come in the other day actually, and he was like, I'm 3-4 weeks out. I think I'm completely healed, but I've got this, irregularity right here. I was like, no, this is what we tell you guys about healing. It's induration, it's swollen, it's, you kind of have irregularities because one area is going to be more swollen than the other. So you have to trust the process of the journey, your healing journey. So just be patient with it. And that's definitely something I wanted to tell him. Just be patient with the process and do what we tell you to, and you'll get a great result.
So you lost weight?
I did.
A bunch?
Right around 100 pounds.
That's a lot of weight.
Yeah. 267 to, in here I was 172.
267?
Yeah. Yeah.
Did your face kind of?
Yeah, it was.
Did you recognize him?
I didn't know him at that time.
Oh, is that right?
She knew me after the hard work.
Yeah.
So.
Oh my God. Did you feel more confident after you lost the weight?
100%, yeah. I really feel like these last few months as well, I've really dialed in training and diet. So I've treated surgery like, a big deal. So prepared to get in as best shape as I could.
Good for you. Awesome. I love to hear this kind of stuff because it's all about diet and exercise and, doing the basic stuff you need to do to get yourself into good shape. And it's not to be a pretty boy necessarily, but it's really for health reasons.
Yeah.
So as a consequence of the weight loss is usually skin. So we know when we lose, it's like deflating the balloon. You let the balloon out, and then all of a sudden, the balloon is not as big as it was. And he's actually done really well. So he's got skin laxity for sure. And if I didn't know his history and I examined him, I could tell you it's pretty obvious that he lost the weight. So the concern that everybody has when we lose weight is like, okay, well, does he need to have skin removal or not? In his case, you never tell him what he wants to hear, but there's no doubt that if he were my son, for instance, that we wouldn't do skin removal because he doesn't need it. His nipple's at a good location now. It's on the body here of his nice pec muscle. He's got some of this laxity over here. He's got some tissue in this region over here. But he's really a setup for a pretty darn nice result because what's going to happen is thinning out the skin in this region is going to help it contract, and also the normal healing scar formation is going to actually help us to get that nice skin retraction. But it also depends on his behavior, and he has to get his shoulders back and up, because move your shoulders forward and stuff like that. So you see how this gets all loose? Go back and nice. See how that's nice and tight? So getting your chest up and out is a big deal to getting this where we need to get it. Do you picture this as sort of like the icing on the cake kind of thing?
Yeah, I feel like this is the final step to kind of have like that true confidence in my physique. I feel like I've done a lot of hard work in the preparation, and this is like the final step. I feel like.
Good feel.
Yeah.
And you kind of get it, right?
Mm-hmm. Yeah. I'm very, very proud of him.
Yeah, it's been a huge support the whole time.
So, a lot of people watch our stuff, as you well know, our stuff because it's us, right? And that's why I love he wanted to make a video, so we're like.
He said he's watched every video.
Yeah. Well, I hear that all day long, and I don't know how you do it. Watch every video. I'd be like, oh my God. I do binge watch certain shows and stuff, but not myself for darn sure. But it's a privilege and an honor to have patients that tell me they watch every video. But if you had to reach out to millions of guys out there worldwide, what would you tell them?
I feel like amongst the men that have gynecomastia, it really is a brotherhood. It is, and we experience a lot of the same feelings as far as the embarrassment and the insecurity, and I just think do whatever you can in your power to get it done. If it really bothers you, whatever you can. And I know money's a big thing, of course, for everybody,
always, yeah.
Get it while you can. You don't want to look back and regret not getting it, not living life to the fullest potential, for sure. So
been a long time coming. I hear a lot of that, and set me free. I hear a lot of that, and those are words well spoken, and get your body in a preparatory mode for this stuff too. If you're overweight, remember, I go by BMI. It's not totally accurate, but I look at your picture and I can tell. I'm 6'2", trying to lose weight for my daughter's wedding, and I'm about 200, so I know how I look, and it's like, whoa. I get someone who just sent me an email today, he's 6'2", 260. Mm-hmm. And he's not even like he's muscle stuff. So he's kind of swollen. He needs to lose 40, 50 pounds before the surgery, and it makes everything work really well. You got a marker?
I do.
So his actual sort of meat and potatoes is in this area, which is, you know, pretty classic. And then what we're going to do with the...
You want the other one?
Yeah. I'm going to reverse this because usually we do it opposite. But we're going to have to contour the whole area here, particularly over here too, to get the skin to heal back. So he's really more of a skin issue. And look how nice his pecs are. So you've been working those pecs?
Yeah. They've been a priority in the preparation. So.
And what's great is, he doesn't have a lot of tissue, so you're going to see really his pecs in full glory. A lot of people actually do differential pec workouts where they try to work out the upper part so it makes the lower part look smaller, so it makes your gynecomastia look less. What do they do? Those reverse inclines or declines or whatever they call them. In his case, his pec is just in its perfect shape, so he's going to get an instant benefit. What say you?
I'm just very happy for him.
It's called the support system here, right?
Yep,
And
that's it.
how long have you known him?
We've been together for a little bit over a year now. So
Nice.
yeah.
During the whole journey.
Yeah, and
Yep.
early in the relationship, and I know that's a big issue amongst men with gynecomastia, even in relationships, it's
Who wants to take your shirt off?
Yeah. So we had that conversation pretty early on, and she was super understanding, the whole time.
But you didn't think it was terrible, right?
No.
Okay, but that's the typical male-female thing.
Yeah.
So it's like
Yeah.
most of them are like, okay, I don't know what he was so bent out of shape, but there are things that you may have that you think is a deal breaker, but we're like, what's the big deal, right?
Right.
So it's almost like one of the things that men hold dear to themselves. We're not interested in having this kind of fluffy chest kind of syndrome. Definitely not. Love that you mentioned the brotherhood. That means a lot to me because it's brotherhood is all about helping each other. And with his video, we're going to talk a little bit about skin, but I really want to talk about safety today and why we're really up to snuff on this whole safety thing and why we like boring results, which basically means you just get what you get and we don't have any funky stuff going on. But I know that people go to people all over the world, so I just have to try to give them advice on safety tips to stay out of trouble, make sure that this is not more eventful than it needs to be, right? So I think safety is always paramount. If you go to good docs, it's number one, no matter how you look at it. And I think most of you folks know about us, but we're going to tell you a little bit more about our safety in detail. Baby! Baby! Let's go get him. Let's go get him. So you could actually appreciate his skin is even more lax than we thought when he's lying down, which is pretty typical. Yeah. How much weight did you lose?
100 pounds.
Oh my God.
A lot.
I always find it interesting how nervous people get before surgery. I guess it's normal, right? Don't you think it's normal now?
Very normal.
Yeah, pretty consistent. And I guess that's normal. But if you knew what I knew, I think maybe you feel a little better. I guess you shouldn't just come running down here wanting it, although we got plenty of people that do that, right? But sometimes it just, the nerves is amazing. And so we're going to talk about safety today. So first thing we're going to talk about is where to get plastic surgery. Hospital's obviously a location you can get, but this is an outpatient facility. It's a small place, but it's actually sort of an OR in and of itself. The whole experience is very much like an operating room, because that's what we are.
It is an operating
It is an operating room. And we get our facility credentialed by the major credentialing body. And what that means is lots of hoops that we have to jump through in order to make sure that everything is up to snuff, which is fine actually, because we would do that normally anyway. So we're not the ones that really need people to tell us how to run and operate a good facility. We already know that. If you come from good places and you trained well, it's pretty obvious what needs to be done. It's all about safety and not cutting corners and crossing your T's and dotting your I's. And we get, every 3 years we get checked out? Is that the deal?
More than that.
Oh yeah, that's true.
2 years they come anyway. But then every 6 months we have to submit stuff.
Yeah, I mean, there's a routine, and we got to keep everything going. That's really what it boils down to. And that's a good thing. Just keeps everything fresh and up to date, current. And then the other things that we do is we have great team members like Mauritius behind me here. Right?
Hello.
So Nurse Mar's been, how many cases have you done, Muladi? Yes, Paresa? A few thousand, you think?
Quite a bit.
Yeah, she's done a
Yeah.
few thousand. And then Nurse Lacey, who introduced this case, has been with us for how long, Nurse Lacey?
12 years.
Oh my God.
12 years.
Since she was
Don't try to figure out how old I am. Okay?
That's
I was
right.
here when I was
In fact,
16.
she didn't have that. She didn't have her son when she was working here, right?
Right.
So it's been a while.
Oh yes.
And
Lived a lot of life in here.
so what I like to tell everybody is that, I don't have problem retaining people, and we don't have like huge turnover or anything. So we got a lot of people that have been doing their jobs for a long time, which is super cool. They know it. It takes a while. I mean, we learned that it probably takes 2 years to train a nurse, or any staff for that matter. It really does. It takes 2 years. So when you go to practices where everyone is sort of new all the time, which is actually very common nowadays, think about that. That new person, I'm talking about taking 2 years to get trained, and now you're, woohoo. So what that leads to is potential just oversight or errors or things like that, or just miscommunication, and we don't have that here. Place runs pretty much like a top, and then we have none other than our esteemed anesthesiologist, who's an MD, by the way, and
Being on video.
he hates being on video. Yeah.
We'll have a nice photo of it.
Yeah, well, nice. Yeah. He's been on video, but he's been doing this for a long time as well, and he is an MD, so it's not like we're cutting corners. I think what you'll notice is a lot of places who employ nurse anesthetists, or what they call CRNAs, and we're not saying they're bad people by any stretch of the imagination, but they're not doctors, and so even if it's overkill, which I find it hard to believe, I'd rather be safe than sorry. So it's just nice to have the confidence and the experience of an anesthesiologist. The operation itself is really brief anyway. It only takes about an hour in most cases. And that's good because you're really not with anesthesia that long. And much of the risk for a lot of surgeries is related to anesthesia time. So if you're in there for 6 or 8 hours, the risk is increased. But as I like to tell all my patients, I've never seen a problem with anesthesia, ever. So common things happen commonly, and that's not one of them. And we certainly have a long track record of performing pretty much flawless, uneventful procedures, which means nobody's expired on us, and we haven't transferred anybody to a hospital or anything.
No, don't worry.
Yeah, we take care of stuff. It's nice. We like to call it a boring practice where not much happens. We're not boring, but we like to have a boring practice where you come and you really get what you...
I would like to call it boring.
Oh, yeah, boring.
I want to call it uneventful. Yes.
Uneventful. Yeah. You get what you came for. How about that?
Yeah.
What a surprise. You get what you came for, which is pretty cool.
A disaster-proof practice.
Yeah, really. Yeah, disaster-proof. Well, you hear stories all the time, and actually, it's funny how my patients hear more stories than I do because they're online and they get to read about all sorts of funky things and previous experiences and everything. One of the things I can tell you about anesthesia in particular is that we do some cases on the local if they're warranted. Small zone one up front, that can be done on the local if you want. There's a lot of people who actually choose not to have local because they like anesthesia. Great thing about anesthesia is that, you know, you don't feel a darn thing. It's,
You wake up in 2 seconds,
Yeah.
it's done. Yeah, you think it literally happened in 2 seconds.
yeah. How many times people,
Yeah, they always
they're sitting there
wake up
and
and
go,
they're like, it's over?
yeah, it's
And you
over. And
start?
we're like, yeah, it's over. And that's pretty cool. I mean, it's just a nice way to fly. It's actually ideal for such a kind of a short case. And what I like to tell people, I bet you what you already know is we've done a few of these. And that's important. So along the experience matters. Yeah, we've done a lot of these, and so it's even more than that. We published 2 papers, what I call important papers, for modern gynecomastia treatment, and kind of put it all together in a way that the diagnosis is simpler and the treatment is simpler, and so simpler treatment means, you know, better, less risky treatment and better results. There's no question that the results are just much more predictable than they used to be in the past. As I told people, you know, 40 years ago, the treatment of this condition was worse than having the condition because they just took out some stuff here and they didn't contour the chest. Liposuction came in the 80s. So with the advent with liposuction, it became more of the chest sculpting, because it's more than just removal of, you know, some tissue here. You got to really sculpt up the chest so it looks good. Everything looks normal, smooth, you know, good definition, all that kind of stuff. I mean, it's like anything else in life. Any successful business or any successful team or any successful organization or sport, you know, has to be well run, right? That's the way it is.
Well oiled.
Well oiled. So in our particular case, you know, we have high expectations on what we need to accomplish, and it would seem intuitively obvious that everybody would have the same, but as you well know, that's not the case, and some people are just better at organizing stuff than others, and that whole teamwork depends on people being together for long periods of time and sort of knowing each other and knowing
Not
the
having to
expectations.
talk.
Yeah.
That's a big thing.
Yeah.
Not having to talk to each
Yeah,
other.
yeah.
You already know what you're talking about.
You
We
already
have
know.
our own language, Lacey and I.
Yeah. These nurses have been together for a while, man. It's kind of bizarre. It's a little bizarre. And that's a big deal. I mean, I think most people sense that when they come to us. We're a little different, especially if they've seen some other organizations or gynecomastia surgeons or whatever. You know, their experience is a little bit different. We treat you like family here for sure. I mean, I think everyone wants to treat you nice, but you know, I kind of wonder what it would be like to have gynecomastia in a hospital. That's kind of weird. Just kind of to me, it's the wrong setting. So office space is good, or a surgery center is probably good. Hospital, I'm not sure you need it.
I feel like if you did it in the hospital, you'd have other underlying conditions.
Well,
That's probably
maybe,
the
but
reason
no.
why you would do it in
Well,
the hospital.
some
But that
doctors
maybe
don't
that's
have
the reason.
access to. This is a great opportunity for patients to really have great surgery and not go through that sort of weird hospital stuff, you know, the whole hospital experience. But on the other hand, you got to be careful. You don't want to go to some flimsy,
920.
you know. You don't want to go to the mall to have your surgery done, you know.
And you joke about that, but it's true. There are strip malls that have.
Yeah. You know, you gotta, you know.
Here in the States?
Oh yeah.
What?
Even
Sure.
We could specifically call one out by name right now, but I'm not
even
going to.
the malls in Austin. I'm
Yeah.
just saying, in the States, the malls in Austin.
Well, I mean,
It's a strip
To
mall.
get plastic surgery?
Like, Yep.
Yeah. You gotta be careful. I mean, you gotta know who's taking care of you. I mean, I would say if you really care about your safety, then you have to make sure you understand who's doing your surgery, and you'd be shocked how many people don't do that, which is really strange. You know, if you vet real places, you know, they should be, I mean, I'm happy to have my place vetted by, and most of you folks know me anyway, so it's, you know, you've seen the videos and seen the credentials, and certainly we have thousands of people who've written about us ahead of time. I mean, that must make it easier to at least focus in on some practices that you may want to visit, you know.
Well, it's nice because if you watch all the videos and you were watching exactly where you would be in the OR.
Yeah, same people, yeah.
The nice trees out the
The
window.
whole thing, yeah.
You don't get to see them, you're out.
Yeah.
At least you know your doctor is serene. When
Yeah. Well, we get to watch the change of seasons or something like that, you know. And I think it's all important stuff. What else you got on that list that you got? I mean, why do you think we're safe?
Nothing
Liz?
bad happens in my house.
Oh yeah, nothing bad happens in my house. Which is, you know, I'm a competitor in terms of sports as well. You know, I played a lot of sports when I was young, and you know, the whole term "nothing bad happens in my house." We don't lose in my house. You got to protect your house, and so this is my house, and you know. I'll fight for every patient that comes to my house because they want me to be on their side, and I take that very seriously. So, you know, what I could tell you is that the procedure, as we we wrote the book. We wrote the, you know, so we're not even talking about the procedure. I mean, one of the biggest things they're worried about is the outcome of the procedure. Well, you know, it should be boring.
Uneventful.
Yeah, uneventful. But I mean, that very much depends on how many you do, right? And how good they are, right? So we only do 400 some odd cases a year. So, you know, that's pretty cool. I mean, that says a lot right there. So I've seen a lot more subspecialization lately because I think people want to control everything, and if you go to someone who's done a million of something, more than likely that's going to be in your favor in terms of their skill set and everything. So that's the whole experience matters. And it's okay to ask your surgeon how many they've done or whatever, because that's real. The more you do, the better you get, right?
Experience is key.
Yeah, experience is key. He's got lax skin, there's no doubt about that.
Yeah.
He did pretty good though, I gotta tell you, with his skin.
Yeah, what do you think his challenges will be with his skin?
Well, the deal with anybody who has sagging of the chest or lax skin is getting that skin to go back nice, okay? So, one of the things I think I've introduced to the whole concept of gynecomastia is that you really shouldn't underestimate the ability of the skin to retract. So that means that, you know, when I came out of training, and if I were to see a lot of these people, I'd be like, oh man, I got to cut that out, and I got to suture up skin and do all this kind of stuff, because it almost is the size of a female breast, so naturally you do the same thing. But that's just not the right thinking, not even close. You don't think of the treatment of gynecomastia the same as you would a female breast. And truly inexperienced surgeons would tell you need, you know, inverted T pattern or circular incisions around the areola and all this nonsense. It's really not that way. The results ultimately depend on what you did, obviously, but the quality of the patient's skin. If they got good skin, you'd be shocked at how that goes back. Now, in his particular case, I feel confident his skin's going to go back well, but he's got to make sure it stays back well, and he's got to make sure he gets his posture right. He's got to use that lipofoam to his advantage to help hold that skin in the ideal position as he's healing up, because that skin's going to solidify down there probably in a week or two, probably more like a week. So if you have a crease and you're several weeks out, you got to get at it. You know, you got to definitely get at it. And so we always tell people to start working their skin at 3 weeks, That's with the massage gun and everything. But for skin folds or little creases, you got to get that almost from day one. You got to make sure that that skin is nice, because otherwise it just hardens down and it becomes more challenging to flatten out. What else about safety?
You talk about being OCD and control freak.
Well, you know, talk to the nurses. Maybe they'll tell you. You know.
It's
Yeah.
definitely an environment where that.
Yeah. Well, I tell
serves you,
I
right?
tell a jokey story that at one juncture in the practice I could have moved out to a much bigger facility, and I didn't. And the reason why is simple. I couldn't be within eye shot and earshot of everybody, and so we stay in this small little facility. This this close-knit environment.
Open door policy to an extreme. Yeah.
We have a small facility, but the fact is, you know, you really can't hide anything, and
Everybody knows what's going on.
everyone knows what's going on, and it really does make it more efficient, because everything is kind of, it's close, you know, and so if I hear someone saying something that's not accurate, I can help them out and I can educate. It's a constant educational process anyway. Because otherwise I'd be in my office someplace and everyone else would be doing something else, and who knows what's, you know, would sort of slip through. So there's some huge advantages to a small place. Advantages for you, by the way, because I wouldn't mind a big office overlooking more trees and mountains and stuff, but that's not what I got. But it's all good. What else?
That's everything on your list.
That's the whole list. Nothing but the list.
Pretty much.
Well, what say you, Mar? What do you think? Safety. Why are we safe?
Well,
Or how?
ours.
Yeah, how are we safe? Yeah. Well, Mar has to do. Well, she helps with credentialing,
Oh yes.
but we don't really learn much from that, right?
That's not really much.
We already do everything you're supposed to do. And,
Yeah.
I mean, it's basic stuff. It really is, you know. Make sure you have these drugs and
You
those
say
drugs.
that, but the people that come to do the inspections always praise us a lot.
Yeah,
We're like A students over here.
yeah. Well, I mean, just having an MD as a medical director is a huge thing, because, you know, you got to have, it all starts with people, obviously, right? So I don't care what kind of facility you have. You can have the dream facility of the world with iron curtains and you know, golden tinged, you know, everything that gives you that aura that, you know, of wealth and whatever. But at the end of the day, it's the people who determine your destiny, not how cool a facility looks. Got to be clean for sure.
Yeah.
But you know, I think that if you want to stay out of trouble, number one is just don't go to people that would lead to trouble, which basically means do your homework. You know, there's really not a lot of us gynecomastia surgeons out there. There's more than there used to be because of us. But that's okay. Just make sure they're real.
Same on the others.
Okay, make sure they're doing their thing properly. All right, so I just finished doing some Vaser, ultrasonic liposuction. His tissue is dense. It's that whole weight loss kind of stuff. It's almost like it's concentrated fat. He probably has some gland up under the nipple areola complex, but it's just super concentrated. And you don't lose weight and your gynecomastia goes away. In fact, it's the opposite. You gain weight, you get gynecomastia. And then when you discovered that, you try to lose weight thinking, oh, you know, I gained this weight, 50, 80 pounds, whatever, 60, 40. I got these breasts that I never had, so I'll just go ahead and lose your weight. Well, doesn't work out that way, because you got gynecomastia because you gained the weight, and then it becomes sort of firm and built in. You know, it becomes established. And then once it becomes established, there's nothing you can do about it. So it becomes fibrotic. I mean, you can go through a tenderness stage and all that other kind of stuff, but it just basically burns out, and then it's just not susceptible to weight loss. Never met a patient in my life that said they lost weight and gynecomastia went away. In fact, it makes it look worse. Because
emphasizes it.
Yeah, it just more emphasis. So you lose weight, and then everything just kind of sits up here, and it's like, oh, that looks funny. In fact, again, it's the polar opposite. The reason why people gain weight, or I should say, I don't know if they do that intentionally, some do, is because it makes it look less noticeable. So you could imagine if you have
See it this way.
a hill here and then hills everywhere else, it sort of blends in, as opposed to if you lose a bunch of weight, you know, everything's all flat, and then you have, you know, a mountain up over in this region over here. You turn off that lipo machine.
Good thing.
So if I were to summarize sort of the papers that I wrote regarding gynecomastia, modern gynecomastia, the first paper was really just a description of the zone system, and there was some insights to what I had sort of observed by doing a few thousand. And I think those insights would be helpful to the younger docs that are trying to really understand the modern gynecomastia, what's going on and everything, and just help them to get sort of better results. But the classification for the zones was a big deal because the previous classification systems were well intended, you know, I mean, that's what I grew up with, but they really were not that helpful because they just didn't really describe the situation at hand. And what I clearly learned is we use the zone system all day long. You know, we talk to patients, it helps us to communicate. When I dictate, I describe what I'm doing, what zone, anything that's different in another zone, and it really directs the treatment to an area, right? So instead of looking at it as, oh, the gyno here, see, the stuff I'm working on right now is getting this central gland out here, and then the effect that treatment here will have everywhere else. I mean, you know, we have to go underneath the arm into the lateral zones, or down up over here in the zone 4. That's just to make the chest look really nice, masculine. That's what you want, right? You want a nice looking chest. So that was the purpose of the first paper. And then the second paper was just a report on, like, I think it was a year or two worth of cases in terms of how we do the actual, how we evolved to do the surgery. And so the interesting thing is, here we are, what, where are we now?
2023?
2023, yeah. Like, what's changed? What's changed? Anything?
And how the procedure's done?
Well, yeah. You know, has anything changed?
Nope.
Not really. So that's a good sign. That's sort of, you know, both these papers sort of in my own hands have withstood the test of time, because it's like, you know, I still depend on the zone system for sure. And the way I treat it is pretty much the same. And so that's a good sign as well, because I could tell you that there's plenty of papers in my lifetime that, you know, the docs wrote something that you thought was kind of cool, but then all of a sudden you meet him at a meeting a few years later, and oh no, we don't do that anymore, because, you know, it didn't withstand the test of time. This so far has, which is good, and I just think other people have to do it in large enough numbers where they too find success. And it's nothing earth-shattering, by the way. It's just something that we would think is just reliable and consistent, which makes reliable and consistent results, okay? Because that's what we're looking at. So that's essentially his beef, if you will, okay? Now looking under here, he's got a big pack. This is pack prepectoral fascia. I got to do some sculpture in here. I'm going to probably do a little bit laterally over here as well and get that nice.
In that section, please.
Might as well do it while we got him on this side. Remember, we're trying to make that skin stick down by creating scar tissue. Wow.
There you go. There you go.
And I use various cannulas at this juncture depending on the circumstances. If it's really tough, I may pull out my cheese grater cannula, which is just more vicious, if you will. It's stronger at pulling out some of that tougher tissue, because his tissue is tough. Lower the table a little bit, sir. And so this is the lateral zone 2. We had that skin. You can see it there.
You can see it right here.
Yeah. Blake, you can see it better.
Yeah, it was an interpretation.
Yeah, right there.
There you go.
So that's where we're trying to treat that area.
Mm-hmm.
See that right there? Point to it, Lace. Yeah. Trying to contour that now to create scar tissue, essentially. So we get that skin to lie back nice.
What time on the other side? 9:23.
And it's funny when I think about it, the hardest part of this operation, if it's this hard, but right now, got to get this all smooth and even. And that's not so. So give me the cheeser, please.
Okay.
So we're going to pull out the cheese grater here because I could just tell his fat is just.
Well, and anytime that there's a weight loss patient, which is this patient, fat tends to want to stick. Doesn't want to come out as easily.
Yeah. Wants to stay there.
Yeah.
So we got to coax it out.
I feel like you have to show why you call it a cheese grater. It's not an actual cheese grater.
Yeah. We should probably give it watch that thing. We should probably give it a different name.
Yeah.
Well, what name should we give it?
What does it say on it? Is there?
Oh, the name of the company?
Well, does it say anything else on there?
It just says fast lipo. Yeah, let's see. Can you see that?
Put it against the.
And then
Can you see
show
that?
in comparison to the other.
See, it's got multiple openings here, and
Compared to
there's a little sharpness. This
this
is
one.
a blunt cannula. This has got some sharp. I mean, that's why it looks like it.
It's almost like it's.
That's why we say a cheese
I
grater.
mean, I had
Yes,
some Pecorino Romano the other night, and it's the same kind of cheese grater thing. You know?
Natalie can't help it.
And this is the small one. It's doing a better job of contouring the fat for sure. See, that looks better already. This little lumpy area up here. That's better.
So there's your Slurpee for the day.
Wow.
Oh my.
Wow.
You're as bad as he is.
1, 2, 3, 4, 5.
Putting you to work today, huh?
Oh yeah, but this is the artistic part. Okay, so I'm going to show you. He's got a good example. Look at that muscle there. Can you see that?
Here, no.
Look at that. That's all muscle right there. Striated muscle. That's his pec muscle. And I got some of this inferior tissue here. This flap. Nice fat. I want fat underneath there. See, otherwise there's a little layer of fat here, dermis everywhere else. I'm trying to cover up the muscle so that you don't have skin down on muscle, which could adhere. So pulling up some of the local anatomy comes in handy. And certainly this isn't brain surgery, but it is helpful, and it's readily available, and quite frankly it's never been described to the degree that it has since I wrote about it. And that's it, just being aware of some anatomy. I mean, you can imagine how that all started off. I'm sitting there, I'm like, oh boy, I removed all that tissue. Now what happens? You know, there's a defect, there's a hole, so I got to fill it in. But thank God there was tissue around there to work with. And then you go to the anatomy books and you learn about the layers of the chest. It all comes in handy. See that? Got some nice coverage here. And this is not gynecomastia, this is the peripheral tissue. Gynecomastia tissue central. Take that out. Oh, maybe leave it in there. No, use your fingers. And so you could see why you have to do massage and all that kind of stuff when you're done after a few weeks, so you could loosen all this up and keep it nice and smooth and flat. So any extra tissues, you know, there's a little bit of fullness up here. May be able to pull that down, but maybe not. If I can't, let me see. Yeah, that'd be hard to move that anywhere, so I gotta thin this out just a wee bit. Otherwise it's just a ledge. I want to smooth it out. Yeah, that's better. And then there's a little tethering right here. Just switch with you again, okay?
He's gonna come this way. Like him.
So you want to, so look over here. So if you want to come down here, Mike, and see. So there's a little tethering. So when we pull that stitch, it just got stuck right there. And if you look in here, it's these fibers right here. See this right here? So this is what you call undermining. So I'm undermining just in that area to free it up. And see now the tissues lie nice. All right, that looks nice. This here is a little bit of a bump, but it's nothing terrible, and it's certainly going to get better with time. We treated the area that goes off to the side below the infirmary fold here, so that should be good. And this looks nice. And we know we removed all the offending tissue, and on the underside here, that's just dermis. There's nothing here, so we removed all the tissue. Remember, the premise of my paper was, is it possible to remove all the tissue? Okay, rotate towards the other side. I think he's got a bigger piece on this side over here. Mar's giving me instruments, but the best instrument I often have is my finger, because it really, this gynecomastia lends itself to easy finger extraction, which is blunt and atraumatic in a way, which is nice. There's different ways of getting this tissue out. This is the way that works best for me. Easiest, fastest. So you can see how this is stuck down over here. And so I'm going to pull this up a little bit and liberate or find an opening so I can get underneath it with my finger. Oh yeah. And then once I have that opening, I'm on top of the muscle and I'm getting around this thing. Oh boy. So it's not totally atraumatic. One of my good friends has gynecomastia. He's a surgeon nonetheless. Says, you keep pulling, and I'm like, oh, dude, it works.
What's he do surgery on himself?
Oh, he was a spine surgeon, but so you can see.
He's like, I can't be that rough with a spine.
Look at that.
True.
So you can see.
That was a big.
Yeah, this was bigger on this side. Now, this big load here was right underneath the nipple. That's how you get that puffy nipple. And this is like what we call condensed tissue. You know, you lose the weight, you can imagine. It just becomes this big pile of stuff, for want of a more technical term. Stuff. And I'm left with whatever I'm left with. Some of this is fat up over here. So I'm going to go right to the...
Please, can you turn that light down?
Right to the... We got to change the name. We're going to call it Origins. How about that? Why don't we call it Origins? That sounds so pathetic.
Reminds me of a skincare line.
Yeah. Well...
It's the exfoliating lipo.
Yeah. We got to figure out a name for this.
Internal.
Natalie's here. She's got to ask you guys on Instagram, what names do you suggest, you know? Give us a name. Because we're always looking for stuff that you people can relate to. We're medical, so we're different. Cheese grater. Remember we used to use, when we used the cheese grater during local cases, always the guys are like, you're using a cheese grater?
Really big.
And I'm like,
No, it's not.
no, not exactly. It's not a cheese grater.
It's not really a cheese grater.
Not a cheesy. It's not Chuck E. Cheesy. Chuck E. Cheeser.
The fat shredder.
That sounds bad, too.
Yeah, that sounds bad. You got to make it sound like it's. How about Smart Life? No, that's something different.
Well, that's like that exfoliator, you know?
Exfoliating lipo.
Yeah. Exfoliate from the inside out.
The what? The things that you scrape your feet.
Oh.
Yeah, well,
Oh, yeah.
no, they actually have. That's like a cheese grater. No, but that's a stone. They have the one that looks just like a cheese
Like
grater.
a cheese grater.
Yeah,
It's like a cheese grater. You could just use a cheese grater.
Yeah. Put the word medical on something and you can charge 100 times the price.
Medical grade cheese grater.
Yeah.
This would be good.
Call it the guy grinder.
The guy.
I don't think that one's way worse.
That sounds
I'll
terrible.
definitely take the cheese grater over the guy grinder.
That's like that movie I watched the other night. I made my friend watch it, Fresh. Yeah,
It's called Fresh.
Fresh, yeah.
It's a show.
It's a movie.
Movie.
Right. What's it about?
Cannibalism.
Well,
Yeah.
How long is this patient staying in town, Liz?
That's a Wednesday.
Oh, good.
You stay until Wednesday?
Yeah.
Just because?
Well, then they're going to stay with his brother, I believe, in Fort Worth.
Oh, nice.
Yeah, they
Like
kind
a
of wanted
week.
to stay
Yeah, they
close,
were
just in
driving,
case,
so.
you know, anything
Yeah.
happened, they needed to come back. But also seems like they have family trust. Yeah, but they made a long drive, 2 days of driving.
Where'd they drive from?
Iowa.
Oh, Iowa. Yeah, we got a lot of Iowans. We got a lot of Iowans.
Yeah, I heard her accent a little bit.
Could you?
Midwest,
I don't
they.
know what that accent is. It's
Yeah,
like
what
Midwest.
is that?
Almost like Minnesota.
Well, Midwest.
Maybe she's not from that island.
So we're just checking for hemostasis here. The vessel right there. Can you get that little handheld quarter? So you can see that vessel there. Not doing much, but I'm gonna just give it a rest.
He did.
A rest in peace kind of thing here. So you could see these vessels here. You see these?
Bed.
Alright, that's good. Alright, so that looks pretty good. I think I got a little more up here. I'm gonna do the same thing I did on the other side. I gotta reduce a little bit of this just to make it a little bit smoother. Much better. You can see how this is like a layer of tissue here. All right, let me take my stitcheroo here. So, grabbing some from above. Some of this from below. See how this lays out. Check the tension on. Okay, let go. Let's see. So you can see how that's tethered right there, but I'm going to do the same thing I did on the other side. Just release that little tether. So there's some mobility in the tissues that I could, gives me some leeway. Because if there's no mobility and I remove something, I wouldn't be able to fill it in, but there it is mobile, which is cool. And I love seeing those fat globules because it's going to be underneath the skin, and it's going to be a nice buffer so that it doesn't stick down, and it's also filling it in so that there's no depression or contour deformity. So if your doctor removes it all and doesn't do this, it's probably going to get interesting. So I you know, yeah, see, that looks good. A little fullness right there, but nothing terrible. Checking it side to side. It's got some nice angles over there. Have to release this tether over here. Same thing you see right there. So I'm going to get down here. I can do this blindly. See that? Just release. Release it.
Reduce?
That's released. And that's air. And I just see a little bit of fullness right there. Right here. So I'm going to just contour this a little bit. It looks better. Okay. Much better. So, you know, there's no doubt that the nipple areola complex went back, right? I can shift it around. Remember that, how I can shift it. See this? It's freed up. So that's why you want it to get this to lay down nice and flat. It's on this nice fatty surface on top of the muscle. No bleeding. Contour looks good. I think this is good. think a little bit up over here, and I saw right here. Yeah, that's better. That's good. I like it. So there you go. And just gonna show you the beef. Where's the beef?
They grab the camera.
Okay.
So pretty ordinary case, I guess, in terms of what we did, because we do the same thing, just with variations depending on the circumstances. But you could tell his result's going to be fine. And then the issue really then gets back to he looks good on the table, as he should. It's not a procedure that you should have to wait months to see the result. It's pretty much off the table, which is kind of gratifying for sure. And then you work your result, make sure your skin's back well. And I think the premise of this whole video is keep yourself safe, make sure you put yourself in the best hands possible. And if there's any way I can help, please let me know. That's what it's all about. Mara's going to close up, and we're gone.
Easy peasy.
Yeah.
That's awesome. Ah, amazing. I'm gonna pull this out.
Okay.
You okay?
Yep.
Okay. This is good. This is really good. So the big thing, and we discussed this pre-op, was the skin, and I was really concerned if the skin was gonna go back. I wasn't concerned. I was telling you it was gonna go back. But it is something you think about when you have somebody who essentially lost 100 pounds. Is how's that skin gonna do? But like I told you, we see so much of this that I can kind of look at you and go, okay, that's going to do good. And it did. I was thinking maybe we'd see a crease here or a fold, but we don't. So this has gone back. This is what we call primary retraction, just like off the table. It looks good. And this crease that he had underneath here from all the skin laxity is gone. So this is miraculous. And just like they're saying, you can see where this lipofoam was and it pushed all this bruising out, but this is not much bruising at all. He's got swelling in through here. I can see it. I can feel it. You'll hear it.
Oh,
You'll hear like air in here.
Oh, okay.
Your body absorbs it. It's no big deal, but it is kind of like, oh, it sounds like Rice Krispies in here. But this is amazing. So
I was curious because he didn't have any drainage. Like the pads were dry the entire time.
yeah,
And she told me that there were like fluid pockets in there, so
Yeah.
I expected it to be.
his body will absorb anything that's in there. Yeah, and so that's not uncommon.
Okay.
This is cool. Okay, I'm gonna bring Dr. Caridi in because I want him to see it. He'll be stoked. Jeez.
I know. That was this
Have you
side.
spent a lot of time looking at it in the mirror?
Yeah, the first time I got a look, I definitely cried.
Did you really?
Yeah,
We
for
both
sure.
cried.
You
Yeah.
did?
Oh yeah, we cried
Ah.
together, and then we cried the next day too.
Yeah.
It was emotional, but I'm just blown away, honestly, by the whole experience. You know,
Cool. That's awesome.
it's been pretty awesome.
It's good. It's so good.
You ready to go see this?
Is it as good as they?
It is, man.
It's that
It's
good?
good.
He's in a good place.
Okay, he's in a good place. So
It's awesome.
Let's check it out then.
Let's do
Okay,
it.
Let's do it.
you go.
The man of the hour, the tower. Wow. Yeah, you're right. Yeah, good to see you, brother, from another mother. Yeah, what's to argue? Yeah, there is no argument.
Yeah.
So, you look at him like this, it's pretty impressive, right? He is lying down, which makes everyone kind of look good. But, I mean, you wouldn't believe in a million years that all the history we had before we even talked about this, that he lost all that weight and his skin went back really beautifully. Really beautiful. See how, did she show with the video how you can move the skin?
We didn't do that yet. I think she's gonna do that when we do the redress.
Yeah, well, he actually, like I thought, he didn't really have a lot of movement anyway. See, part of the problem is when we take these, when you send us these pictures, you're like this, and then you have to learn to get this up and out, and that just pulls everything up. But I think Lacey in the video is going to show you how we can move the skin, but I'll do a little sneak preview, so watch this carefully. So, in his case, he had a bunch of skin, right? They had just a bunch of floppy stuff, right? What did you have? I don't even remember. It's hard to know. It's the funny thing about it. It's like, forget that. Well, look, you know, you look at him and you say, what was his problem? He didn't have one.
Yeah.
But, you know, basically, if I recall now, he had some sad stuff through here from weight loss, and he had some looser skin over here. Most people say you have to cut the skin out. And what we're going to try to show everybody is that, no, you don't have to. We can get a nice result without having to do that, which therefore leaves them with a scarless chest, which is pretty darn nice. But watch this, folks. So when I say move the skin, typically, since this is always the area of the meat and potatoes here, this is where you're going to have the most sort of deflation of the skin in the central area here. And it's not like pulling up over here like that. Or you can see some movement there, right? And it's definitely flatter. But the way I do the procedure, you see, it's a thin flap that's right in here. You can actually grab this and pull it. Woo. See that? Look at that. Boom. So I just moved it up like half an inch. So that made a nice difference. This side is actually, he doesn't really need much on this side. But the idea is you're grabbing it just above the nipple and you're just literally pulling it up. You're separating the skin from the underlying tissues. Look at that. And then what's going to happen over time is that's going to seal down. And when that seals down, you're good to go. And this area looks fine. He's all swelling through here, which is normal. So that's going to take a few. He's going to work on that with his compression device and all that kind of stuff.
Cool.
Look at you. You got all the big mouth before, now you're quiet.
I'm honestly blown away, by the results. And like we told Lacey, I got emotional. Definitely the first time I saw it.
So, yeah, that's a good thing. That's a good thing, man. It feels good, right? It feels good.
Yeah, we both cried
Yeah.
after because we watched the Instagram reel.
Yeah.
Oh, that's right.
That
I
wasn't
forgot
so
about
bad.
that. I forgot about that. Yeah. So we did an Instagram on his day procedure as well.
Mm-hmm.
There's so many flamograms and Instagrams I can't even keep up. But the fact of the matter is, you know what the fact of the matter is? This is just a real life stuff, okay? And I think that we tend to concentrate a little bit on sort of what we can do to the chest, but remember that it's all about what we're trying to do up here in this Canogan up here, and to make someone feel good about themselves and to smile, okay? It's a BFD. I'm not going to tell you what that means. I think everyone knows. It's a big deal. And so that's what it's all about. That's what creates motivation to, for him to have it done, for me to do it, and the honor and privilege to have it here. That, and he's as sweet as pie, and he asked to do this video. It's really funny. I mean, it's just all cool.
Yeah.
And so, what do you see as your future now?
Honestly, I really want to make sure I do all I can with recovery. I know that it's a lengthy process.
Yeah.
But
Lengthy, but not crazy. It's
yeah.
And he has his playbook, right? Everyone gets the playbook now. A list of 10 things that you got to do.
Right.
And there's no doubt he's going to do them, right? I mean, why would you not?
Yeah. So all the work that went in before surgery, and I told her before the surgery, I'm most worried about recovery because that's all on me. I have so much trust in you and the team. So.
And he knows he follows me. I mean, when people talk the way he talks, it's like, dude, that's what I write about. But that's what he's reading about. That's what he sees in the video. What I try to tell everybody is like, look, I got this surgery down pretty good. I can reliably produce something. It's the baton. I hand that baton off to you. You got to take it and run with it. And so don't ignore it. It's not overwhelming. It's something that doesn't take a lot of time. He can get back to doing this and that in no time. The pain isn't that interesting. But if you just ignore it and take it for granted, there's a possibility you get some scar tissue in there and little skin folds and stuff like that. Right. And then, we don't want that to be a source of constipation, right? We want this to be as perfect as it can get. And he's also realistic. I mean, it looks perfect now. So, it's for his to sort of get the best out of it. And I still can't believe you lost all that weight.
Yeah, man.
Yeah.
Great.
And he's going to be a good video because, we don't have a lot of people about, the whole weight loss and the skin and everything. So you got to keep up with us. Where do you live?
In Iowa.
That's right. My Iowa.
Yeah. That 1,000-mile drive.
Well, you send us, and then he drove here. Think about that. I mean, it's like the Yellow Brick Road, man. It's come the wizard behind the curtains, man. Follow the Yellow Brick Road, and he made his way here. And how cool is that? And how lucky I am to have people willing to travel all that distance, which is super cool. Because I can't drive like you can. I tell you. Who drives? You or him?
We split it on the way here, but I think I'm going to do most of it on the way back. Mm-hmm. But I definitely think that it was worth it to come here to get this surgery from you guys.
Yeah, because you could have got it anywhere, and I'm sure that, we know that, and you know that. But, we're lucky to have you. And we're lucky to have you just as committed to knowing. And, although it's not necessary, right? Mm-hmm. it's still, to see him like this, it's like it's one of them well worth it things. So that's a good thing.
Yeah. If anybody considering getting the surgery, even if it's traveling, I mean, I've been blown away by the whole experience. You and the team and everyone's been so helpful, and you know, it's. I
love you to say that, but I just sometimes feel like people are like misrepresenting. Like, you go anywhere, do whatever you want. I'm honored to have everyone.
I can only speak
want
from
them
my
to be happy,
experience.
but I get embarrassed when people say stuff like that. But I know what you're
You guys
saying.
could have made it any easier for us.
Yeah.
So that's a big deal.
Yeah. Your traveling should be the hardest thing to get here.
Yeah, honestly, yeah.
And now when you go home, you're like,
It's always faster driving home for some reason. Right?
All right, and now we want to get some snippets. Lacey wants to do some
Redressing,
snippets since he's been so helpful. We're trying to get together a better recovery video. Although he may not be the best guy because he looks.
He's too good.
Maybe we can, talk a little bit about the dressing changes and other things. So he's going to help in a lot of ways, and I hope millions of people who watch this video learn a lot of cool stuff that will be helpful for you when you have to make your decision.
Cool.
You want a coffee? Say we're just admiring my next career, and most patients know that I like my coffee machine, but I like to serve them up to people who like. You lit up. She lit up. She's like, cappuccino with sugar? Yeah, baby.
Oh, yeah.
With little chocolate sprinkles on the top there.
You're so sweet. Thank you.
Forget the patient.
Okay, guys, I have an example of, actually this person is 2 days post-op, but same difference. 1 day, 2 day, it doesn't matter. Dressing change will be the same, okay? So he looks great. I have already checked him out. He's good to go. It's time to put everything back on, okay? At home, you would have taken pictures and sent them to us, or at your hotel. I'm putting a thin layer of antibiotic ointment on, sorry, it's sensitive, on these little incisions. I can barely even see it. This one in the armpit heals up so quickly. You don't actually have to put the Neosporin in there, but if you want to, great. All right, so then we've got our fresh ABD pads. These are included in your bag. These are gonna be held in place for by the garment that you have, and you're only gonna use them for probably 2 to 3 days. He's already said that he doesn't have any drainage, but for the purpose of this video, I'm gonna put it on. All right, so garment is in place. I'm gonna put this kind of stuffed up underneath here. The reason I do it where some of it is hanging out is because it creates a buffer between the compression garment and his armpit, whereas a place a lot of people complain of pain, okay? And so yeah, I do that on purpose. And if you want to put an extra one there, say you're in pain and it hurts a lot in the armpit, you can put an extra one there. This one just goes across here, and that goes right there. That lipofoam. All right, if you'll hold your hand just right there for me. Same thing here. There we go. Bring it together, and boom, it's where it needs to be. And of course the lipofoam is a little twisted up in there, but I've learned that if you will go ahead and put the whole garment on and then adjust it, it will actually stay where it needs to.
You made that look so easy.
Thank you. Thank you. All right, so here's the important part. I'm gonna put my hand down in here, lay out the lipofoam where I want it. Same thing over here. I'm gonna move this. I'm sorry if this hurts. I'm so sorry. Okay, and then I'm gonna adjust the garment, make sure it's straight, because if it's not, it feels uncomfortable. And then we're always gonna check the skin. Don't forget this part. So we're looking down in there, make sure that skin is flat. Same thing here. I'm pulling back the lipofoam, the ABD. Pulling up on that nipple, and boom, it's right where we want it to be. All right, now his favorite part is the ACE wrap. Let's get this back on here. So our instructions say to wear this for 2 days post-op. Again, for the purpose of this video, I'm gonna show you guys how I put it on. Can you use your abs to sit forward? Good, good. Let's make sure it's straight. Velcro on the inside. And I'm coming around you. Also, back here on the back side, I always wanna make sure that the garment isn't twisted up, because if it is, it's very uncomfortable. And I'm staying really high with this ACE wrap because it's not good to be putting pressure around your abdomen. That's not the purpose. It's to be putting pressure in the treated area, and that is up high. If you feel like you are 2 days post-op from surgery and you're pretty swollen, it's not a bad idea to wear these for an extra day or so. That's totally fine. They're not hurting anything. Again, I'm straightening the back as I go along. Here we go. All right, you can rest back slow and easy. Pull this up. Look at this. There we go. And then I'm gonna get some safety pins and I'll put one here and one here. And this will just be how he looks for another couple of days. Okay, they just asked me a great question. He's asking when can he wear the compression shirt. And at any point he wants to add a compression shirt to this, that's fine. In the previous video, I did mention that it helps, again, kind of create a buffer in the armpit area so that it doesn't hurt so much. So what you do is you put your compression shirt on, usually it's like a t-shirt length, and then you stuff that lipofoam where it needs to be, where I just showed you guys, and then over the top of that is you'll put your compression garment, this vest on. So you've got all that on there, and it does kind of help comfort-wise. And as soon as he feels ready to do all of that, he can. So if he needs to lift his arms like today, tomorrow to do that, you kind of like slide in it. He can definitely lift his arms to put a compression shirt on.